question is for Ms. Lauren Gray. And I want you to talk to us a little bit about what NYCHA is doing to make sure all of the NYCHA residents have access to getting vaccinated.
So great question. I wish we can vaccinate all of our residents all at one time, but supplies are limited. But we have been working with the mayor's office and the state's office to expand deployment of pop-up vaccination sites to further strengthen fairness and equity in the vaccine distribution process, specifically at NYCHA senior developments. Ensuring the health and safety of NYCHA residents, particularly our seniors, are our most vulnerable New Yorkers, and it's our chief priority. So we have been using NYCHA community and senior centers to host these pop-up vaccine sites. This is based on data that we have of our highest concentration of seniors at our developments. And we're committing to working with our city and state partners to continue connecting our residents to other crucial health and social services throughout the pandemic. So when a pop-up site is made available at a NYCHA center, NYCHA has been assisting with conducting extensive outreach with emails, robocalls, direct phone calls to the residents themselves, flyers in multiple languages, including Spanish, Russian, English, Chinese traditional, and Chinese simplified. We've been doing a door knocking campaign with test and trace at our sites. So residents are known 3 to 4 days in advance about the vaccines that are going to be at the pop-up sites. With the city and the state, they are registered through the city and the state websites, and we host them once, either 21 or 28 days, depending on which vaccine is being administered. And we remind the folks to come down for their second administration of the vaccine.
Thank you. And if you just expand a little bit on those, how about people that may not have access to a website? How are we getting those people registered?
Yeah, so there's flyering throughout the building. They're doing a flyering campaign under the door as well. I believe for both the city and the state, there's a call-in number if you don't have access to the web. We're also doing the door knocking campaign. I know through Test and Trace, they're scheduling residents right at their front door for their appointment. And yeah, so those are the main takeaways in terms of doing the outreach.
Thank you.
You're welcome. Thank you.
If the vaccine is supposed to help the body create antibodies against the virus, if you've had the virus, if you've had COVID-19 and you've recovered, what's the difference between the antibodies that were created from you having the illness and the antibodies that are created from the vaccine?
So that's a very good question. So normally when someone goes through an infection, naturally the body creates antibodies, and that's part of the reason why they survived it. And there is some memory cells with that go along with that. The problem is that we don't know how long that protection will last. And in some situations, the protection may last up to 6 months. So it's important that even if someone has had an infection, to still get the vaccine, to have some guarantee that they will have additional protection.
The answer right now is that we do not know enough about the antibodies that are developed after after someone is vaccinated, and essentially the time, how long those antibodies are going to be present. So this is what we need to learn more about. And so right now, we know that once someone is vaccinated, this is going to infer immunity for some period of time. How long? Just do not know. Well, certainly we do have some idea of natural immunity in individuals after 6 months or some time period after that, those antibodies starting to wane, which is really why we want to get everyone vaccinated, even if you were previously infected. So really important that even with a previous COVID infection that you do get vaccinated. We still need to learn more about the longevity of the antibodies after someone is vaccinated. But yeah, really good question.